Vanakkam, Deepavali Navalsukal. Today I want to tell you why it is important to tell your doctor, dentist or pharmacist about your past history. Let me tell you a story. So I have this patient who has been coming to me for the past 2 years. He always came to do normal checkup, scaling. We chit-chatted, we did the scaling, no problem, no issues. But last week he came to me telling me that he has a cracked tooth on his bottom left molar tooth. So we took a look in his mouth and we found out that actually the tooth was fractured, was broken off completely. It was flat to the level of the gums, the gingiva. So when I take a second look, I realized that the tooth was root canal treated. So there was nothing we can do then. So I recommended the patient to just extract the tooth. He said, okay, no problem since we couldn't save it anymore. If you know, a root canal treated tooth would become more and more brittle because they do not have nerve and blood supply anymore. So when I tried to remove the remaining roots, the root fractured, which was expected. So the extraction took probably half an hour, no issues. Although a bit longer, no issues. Everything came off. All the root fragments came out. And I sent the patient back with some gauze and some medication. But in the afternoon, I received a call. The patient called me telling me, "Doctor, the bleeding didn't stop even after 4 or 5 hours after the extraction." So I called the patient back. I saw him at 5 o'clock. The extraction took place maybe at 11 o'clock that day. So when I saw him, he actually had a lot of blood in his mouth. It's like he was vomiting blood. It was so bad. So when I asked him, "Sir, is there any medical condition that you have and you didn't tell me?" He said, "Yeah, actually I have this deep vein thrombosis, doctor." So what is deep vein thrombosis? Deep vein thrombosis is actually a condition that blood clots are forming in the blood vessels deep inside our body. This type of patient, they have to be on long-term blood thinning or anticoagulant medication. So yes, he was actually on this medication called Xarelto, an anticoagulant to prevent blood clot from forming in his blood vessels. That's why the blood couldn't clot in the mouth after the extraction, and he was bleeding non-stop even after so many hours. So what I did was I packed some hemostat, gave it a good pressure on the wound, and after 1 hour the bleeding stopped. Imagine he came to me in the evening and he had to go through all this worry, all these hassles, all this suffering for the whole night. God knows what would happen when I could only see him the second day. Thank God this didn't happen, and he was fine afterwards. He came back to me for review the next day. He also came back to see me again the next week. The wound was healing fine. The reason he didn't tell me his condition in the first place, even though I asked him when he came for visit, I asked him, he said, "I got no issue, doctor." The reason he told me was whenever he told that he has this condition, no dentist wanted to treat him at all, even for scaling. So he decided to hide his condition, which is not appropriate actually. Yeah. So the moral of the story is actually whenever you go, do not hide your medical condition. Wherever you have hypertension, diabetes, or whatever type of condition, please tell your doctor, tell your dentist that you have this condition so we can manage accordingly. And we can avoid any kind of unnecessary complications if you tell your doctor, your dentist, honestly. So guys, thanks for listening to my stories. Stay healthy, stay safe, and we'll see you in the next video. don't forget to subscribe. Bye bye.